Hi Tilda, this is Eunice from Taiwan PBF. I want to introduce to you our PBF unique cosmetic product Nephroskin for uremic pruritus patient. Uremic pruritus is a pathologic condition that causes an intense, persistent itch originating from within the body. Unfortunately, this disease is irreversible. For diabetic patients, scratching due to uremic pruritus can lead to wounds that are slow to heal. This increases the risk of infection, which, in severe cases, may even result in amputation. Skin itching is a lingering nightmare for dialysis patients. The incidence of uremic pruritus in foreign countries is about 50 to 90%, and that in Taiwan is 55 to 90% similar to the incidence in other countries. In patients with uremic pruritus, 36% became irritable, 8% became depressed, and 40% affected their mood, which in turn caused sleep disorders. These findings are from the Tokyo Kidney Research Institute in Aomori Prefecture. In cases of uremic pruritus, calcium ions have been observed to accumulate primarily in the stratum spinosum layer of the skin. Calcium ion distribution in uremic pruritus shows a pattern where there are fewer calcium ions in the outer layers of the skin and more in the deeper layers. This is the opposite of the distribution seen in normal skin. Between patients with moderate to severe uremic pruritus and those without pruritus, only the transepidermal water loss, brief, is TEWL, was statistically different, p-value is 0.03, and there was no statistical difference in the results of other biochemical tests. The basal layer cells and stratum spinosum layer cells of the moderate to severe uremic pruritus group have higher calcium ion distribution, which is significantly different from the calcium ion distribution of healthy skin. Calcium loss in the upper layer of the epidermis in patients with CKD. The skin barrier layer of patients with CKD is damaged from the loss of calcium ions in the upper layer of the epidermis, which leads to the destruction of the distribution of calcium ions from high to low concentrations, thus unable to lock the moisture in the deep layer of the skin, making the skin dry and aggravating uremia symptoms of itching. Thomas Mettang, from the Department of Nephrology in Germany, showing a recommended management algorithm for itchy skin in patients with chronic kidney disease. In this algorithm, both mild and severe cases of uremic pruritus are advised to use topical moisturizing creams as part of the treatment and add on others treatment. Advice from Thomas Mettang. Topical moisturizers are a basic daily treatment. Adding cooling substances, such as menthol, can relieve skin itching. Left picture shows before and after use PBF Calcium Tech. We have Calcium Tech. Patent for restore the skin calcium level as normal skin condition. Compound calcium ions and other mineral ions into the stratum corneum of the skin through external supplementation, maintains the gradient distribution of calcium ions in the stratum corneum of the skin, restores the complete barrier structure of the skin, and improves skin moisture retention. Today, I want to highlight the added skin-specific nutrients that are beneficial for managing uremic pruritus and promoting overall skin health. We also add sericin as our major ingredient based on follow data. The sericin effect of using it on patients with CKD. Sericin improves skin hydration in arms, reduce skin irritation and pigmentation, and reduce skin itching. We also add other three major ingredient, nicotinamide, ceramide and shea butter. First, nicotinamide, which is an essential vitamin for the skin. It helps strengthen the skin barrier and alleviates discomfort by reducing inflammation and redness. Next, we have a ceramide complex, a blend of 3 key ceramides that are essential for skin repair. Combined with cholesterol, fatty acids, and phytosphingosine, this forms an ingredient called SK influx, which is quickly absorbed and has an excellent skin repairing effect. Lastly, shea butter provides a high concentration of unsaponifiable lipids, vitamins, and other active elements. It's known for its soothing, moisturizing, and protective effects on the skin. Together, These ingredients help improve the skin's resilience, reduce discomfort, and promote healing. Let me conclude the highlight. The primary cause of uremic pruritus is the loss of calcium ions in the upper layers of the skin, leading to dryness and ultimately damaging the skin. Management of uremic pruritus. Both mild and severe cases of uremic pruritus are advised to use topical moisturizing creams as part of the treatment and add on others treatment. Nephroskin is a specially designed product for patients with uremic pruritus. It effectively restores calcium ion concentration in the upper skin layers with PBF calcium tech patent, helping to retain moisture. Enriched with mint, sericin, vitamin B3, ceramide, and shea butter, it provides powerful itch relief and soothes the skin.